Hey everybody, how you doing? This is Kareem. I am actually very excited today. This is my next interview of a professional in the art world, but I wanted to take a little bit of a different angle with it. I'm going into this conversation very much focused on learning more about art therapy, and my goal is to figure out whether or not art therapy is legit. So what I did was I brought in a friend of mine. Her name is Jody Pittner. She is the owner of Truly Connected Counseling and Art Therapy. She's a licensed professional clinical counselor and a board certified art therapist. She operates right here in Northeast Ohio. And I'm going to go ahead and ask her some questions and sort of dive really deep, like get a really good understanding of art therapy so that I understand it, so that you understand it, and so that if you are thinking about art therapy or if you heard about art therapy, then you're getting a clear understanding. So let's go ahead and say hi. Um, Jody, how are you doing today?
Great. Thank you so much for reaching out and chatting about my love and my passion in life. I'm always happy to share about art therapy and sort of what we all do and how we get trained and all the different things that we go through so that when people are interested in it or want to use it for themselves, they really can make good choices and have a clear understanding of what it is.
Yeah, I was gonna write a whole blog on this. I was gonna do a whole blog on this and basically do my own research and figure out where all of this stuff came from, where it's going. But I had the idea, you know what, it might be best if I'm actually talking to an art therapist, because this is like a very serious field. But just so that everyone gets a clearer idea of who you are and what you do, why don't you just tell us a little bit about yourself and your practice?
Sure. Um, I am first and foremost an artist. I have been doing art in lots of different forms and through different studies for my whole life, including I like to include my creative block years because I think that was super important and it taught me a lot about the creative process. So primarily I'm a painter. I do a lot of acrylic, sometimes oil, some portraiture, some um, just things that pop into my mind that I want to put in. A lot of multimedia, layered kind of collagey stuff. Um, and then I also do some sort of abstract stuff. So a lot of like fluid media. I'm really kind of into that right now. Um, and a long time ago in high school, I really wanted to be an artist, but no self-esteem, like thought I was garbage, the whole thing,
Yeah,
right? You
yeah,
have
that's
this idea of
very
what an
common.
artist is,
Hmm.
and I definitely did not think that I was that. So I did not go to, I had wanted to go to Pittsburgh, Art Institute of Pittsburgh, I think it was. And instead I picked something in the business field. So spent a little time in advertising and marketing. And then started a family, kind of got sidetracked from my art, came back around to it and went through some really tough stuff myself. And when I reconnected to my art, it was um, really helped me through a hard time. And I thought, this is interesting. There's something that I can say and feel and express through my art that I can't put into words. And I remember talking to someone about it, and they're like, there's a whole field called art therapy. And I was like, hmm, that's interesting. I wonder what that's about. So I kind of did what you're doing, which is kind of researched it and found, luckily in Cleveland, we have a program at Ursuline College. It's a master's level program. Um, Went to an information session and it was like light bulbs just went on. And I decided that this was the next version of myself that I wanted to pursue. So I found out how to apply and it's a 3-year program. If you already have a master's or not, I mean master's, sorry, bachelor's, then you can do some extra coursework sometimes if you weren't like a psychology major or an art major. So I had to do a little bit of undergraduate coursework before I could get into the master's program. And then I applied for that. And so at age 40, I recreated myself and became an art therapist. And in the program that I went to, it's a dual licensure program. So you are getting a master's in counseling as well as in art therapy. So that's why you heard me say I have 2 licensures. So the LPCC part of my licensure allows me to diagnose and treat mental illness and mental health challenges in the state of Ohio. So I'm licensed in the state of Ohio to do that. My art therapy credentials allow me to practice art therapy. So you do have to have a master's in art therapy to practice. And that's, yeah, I started in adult psych. I worked in inpatient on the psychology units there, and the detox and addiction unit there. And then I switched to Akron Children's Hospital, where I was the pediatric medical art therapist for that hospital, working a lot with the palliative care families, as well as all the different units. So going on to all the different units and working with the children and families there. And then fast forward to about 3 years ago, I opened my own practice in Strongsville. So that's where I am now. I purely private practice at this point. So yeah.
You know, the dual licensure, that's actually a hard word to spit out.
It is really hard to say.
But the dual, that part, that word, that's a really interesting and intriguing part of your credentials, because it's the art therapy part and it's the counseling part. I'm actually interested in what exactly separates art therapy from counseling. Like, what is art therapy exactly?
Yeah, so the field of art therapy has been around since, I would say, around the 1940s. Don't quote me on that because it's been a while since I studied early art therapy history. But a lot of the early people that started the art therapy field noticed that when they would work with children, or sometimes in patients, like one of the first forefathers worked in inpatient psych, they noticed that people who were in a great deal of duress oftentimes could express themselves through visual art making in a way that verbal discussion of things was difficult. And we actually see that in like some of our early psychology forefathers as well, like Carl Jung. He actually was really valued visual symbolism and working with dreams and drawing and painting. And so he actually weaved a lot of that into his early ideas. So early on, I think some of the people that developed the field saw the power of using the creative process to access aspects of ourselves, to tell our stories, to express things that don't have words, that don't come through our words very well. Also to learn about, I think, unconscious things about ourselves. So some of the things about art therapy that are unique is we're trained to understand the visual language that people use. So when someone is creating artwork, we're trained oftentimes to be able to ask certain questions, to bring out what's going on in the process, so that we can go deeper into what is that connected to? What is that within the person that is wanting to talk through this form of, the creative process? So art therapy is a lot more about the process and what's happening between the therapist and the person who's creating the art than it is the end result of what's made. So, in art class, we kind of work around the process. We want to know how to like perfect our ability to shade and do something that visually is what we want to create, whereas art therapy really focuses on the process and using the creative process to allow us to access things that maybe we can't through the verbal parts of our brain. So it's very much rooted in that philosophy of that. So yeah.
Have you found, and I'd like to actually also mention that that is the second interview in a row that Carl Jung was brought up. So, you're keeping a theme going. But
Yeah, he's pretty incredible. Yeah.
yeah, yeah, for sure. I mean, now I feel like I need to really go and get that book. But in those relationships, I guess that you've developed with um like during those processes that you're speaking of, do you find like when it comes to a person's the relationship between people's individual psychologies and art, do you find that there are similarities between artworks that are related to certain feelings, or is it kind of like everyone has their own symbols or expressions that they use?
It's that's a really great question. I think it can be both. Like, I think um, we all have our own sort of symbolism dictionary that we may gravitate towards as artists or as people. So I may use the spiral in my art a lot. I may use like certain colors, palettes, because they're just what I gravitate towards, or I might really focus on animals and nature. So those are the ways that maybe I connect and create through those symbols. Whereas someone else who uses those same symbols may have a completely different definition of why they use it. So the spiral to them might mean their grandmother, and to me it means like the movement through life. And so as an art therapist, we really want to connect to our clients their symbolism and their expression of color and what it means to them and what they associate with it. So it's like if someone were to say, like, can you interpret this dream for me? I'm like, no, I can't, because it's your dream, it's your symbols, your brain, your experiences of life. And we all have our own lenses, we all have our own, experiences, and we all live in this world where we are conditioned, to think and be and feel certain things until we decide not to, or we want to change those things.
Mm-hmm.
So I think when we work with clients, art therapists are kind of trained to get at what it means to them, what their artwork means to them, instead of me interpreting it or putting my projection onto it. So that it's really focused on the client and not the therapist and what I might think they mean. So it's a lot about questions. I could probably give you an example that I think is really might highlight what I'm talking about.
Yeah, I'd love.
Um, yeah, so oftentimes when we look at an image, particularly one that might evoke a lot of emotion, so say we look at something and it almost looks like, let's take an image of a face sort of emerging from the water. So there's one way I could look at that. It could look like someone peacefully floating, in sort of a nirvana state and just being like, this is great and relaxed. Someone else might look at that same image and be like, oh my God, they're drowning. They're getting submerged. They're being taken under, and so when I look at an image and I see that it has a lot of depth and emotion, and that person maybe spent a great deal of time working on it, what I want to know is, what does it mean to them? What story are they trying to tell? What does the image mean to them? And so that's where the transformation and sort of therapy side of things come through. It's like, okay, so if they tell me that's the image, and this is them drowning, or this is them being pulled under, or they're being tossed around the ocean or whatever, then that's information for me as a therapist about how they may be feeling, how they may be handling stress in their life. Maybe they don't feel very capable of handling what's going on in their life. And so we would then use the piece of art to have a conversation about, well, how can we get you feeling stronger? How can we get you feeling like you're more capable of handling all the things that are going on in your life? And so the artwork becomes a facilitator of conversation, of transformation. It can be an indicator sometimes of how people are doing and what they're wanting to focus on, even when they don't know it, that's the cool part, I think. as an art therapist, you're like, those light bulbs go on. Sometimes people just create and they're like, here's my thing. And then we get to facilitate that conversation. They're like, oh my God, that's me, or that's this thing, and they look at their own art, and it's like, it's still a part of that person. And I believe everyone creates from parts of ourselves, and they get to see it. It's like it's not in you anymore. It's out here. It's
Mm-hmm.
like you get to interact with what was created, and you can sometimes see things that you can't otherwise. So that's the other piece of art therapy that I think can really help people when they start to see those creations in front of them, and they get to objectively look at what it was that came through them. So oftentimes the art therapist is a facilitator.
Mm-hmm.
You're a facilitator of holding the space. Because when you have a relationship with a therapist, it's confidential, it's defined, it has boundaries, there's safety, there's an expectation of what's going to happen between you and your therapist. And so, in those conditions, we can often allow things to move through us that otherwise we may not. And so, really, it's about holding space for somebody. It's about facilitating those conversations, those discussions, noticing things. Like when people are creating, like, I noticed you stopped and you tensed up, and like, what happened there? And so there's this whole thing that's going on between the therapist and the person that you're working with. That's very different than I think what people, I think, maybe have experienced with art making
Yeah.
before.
Yeah,
Yeah.
definitely with art making. That's for sure. But also with I guess therapy too. Like there's an idea about what therapy is supposed to be like,
Yep.
that when you go and you're doing art therapy and now art is a part of that, it kind of ties back around to what you were talking about with people who don't or aren't freely speaking, or might find it difficult to vocalize their emotions. But in that vein, I have a question about um, I guess it's more so about how seriously to take art therapy, because people go to counseling for a lot of reasons. People should go to counseling just for general, like life to life, day to day things that they're experiencing. But then a lot of people get referred to counselors for serious mental illnesses, emotional disorders, psychological disorders, and what so I guess my question is, who is art therapy for? Like, can art therapy be for people with diagnosed mental illnesses? And especially your opinion as also a licensed um, clinical counselor on that side of things. And then what 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 does it address? What does art therapy address and treat in that vein?
Yeah, those are great questions. I think that of course, I'm biased. I have to say that I think art therapy can help anybody. I do. Um, but I also do value my training and my license as a clinician who can diagnose and treat mental illness. I have extra training in trauma therapy. I'm a EMDR therapist, so I've spent a lot of hours, and we can maybe get into some of the credentialing and what that actually means, so that folks can understand, well, as ATR or ATRBC, like, what does it actually mean?
Mm-hmm.
And same with LPCC, like, what does that mean? There's so many like letters and things after people's names. Sometimes you're just like, okay, let's just see, let's just see if whatever they do works.
Yeah, yeah.
And so, like, I think it's hard to be a consumer of mental health services in general. Our system is hard to navigate. I think anyone who's had to access mental health services at some point in their life can be really overwhelming. It can be really difficult to um, reach out for support. There's so much. I think we're working on it, but there's still a lot of stigma around mental health, and what does that mean if I am not doing so well, or what does that mean if I'm I don't think I'm just sad or upset anymore. It's like serious depression and symptoms that really need some attention.
Right.
And so, there's all kinds of levels of care, and there's all kinds of places that you will find art therapists. And you can find art therapists in anywhere from a pediatric inpatient kind of setting. Um, those are more like the medical art therapist, the role that I had at Akron Children's Hospital, for example. You'll find art therapists on psychiatric units, both for children and for adults, running groups, for example, doing group therapy, doing facilitating something like what I was just talking about, and in a group, and having people use the creative process to get to know one another, to share from their stories, their pain, whatever it is they're moving through. You can find us on rehab, kind of like dementia and brain injury types of units. We have art therapists that specialize in helping people recover from traumatic brain injuries. We have people who specialize in elderly and dementia care.
Mm-hmm.
And then we have people who are in private practice, like myself, who take insurance, and you can work more on that lower level of care, which is your weekly appointments, or maybe seeing someone and checking in every 2 weeks, and developing more of a lower. So we have kind of these tiers where you will find professionals, mental health professionals, both the LPC versions of my licensure and the art therapist.
Mm-hmm.
So you have the hospital sort of highest level of care, which is inpatient. We're talking about really intense mental health diagnoses, schizophrenia, bipolar, severe depression, um, suicidality, where people come there because they have safety needs and they really need immediate support and stabilization. So they're getting stabilized, maybe their medications are trying to get sorted out. Maybe they're trying to decide if they want to try medication for the first time. So the hospital is really the high level, intense care that you will find. Most mental health, like social workers, they're in that sort of high level care. Those are the more intense diagnoses and the more intense ways that people can interact with mental health care providers. And then we have more of the second tier, which is your like outpatient services. So you have your IOPs and which is intensive outpatient programs. And then you have your partial hospitalization programs, which are often step down programs from like a hospital stay.
Mm-hmm.
And what they do is they're helping people to continue to feel like they're being supported, getting the things figured out that they need to, but also connecting up to support, like groups and therapists for individual therapy, trauma therapists, for example.
Mm-hmm.
And then you have sort of the lower level of care, which are tend to be you're more stable. Maybe most people are fairly functional, like they're able to work, they're able to kind of do the things that their lives are requiring, but they really want to heal. They want to get the support that they need, and to have someone that they're developing a relationship with, that they can check in and have someone sort of who knows who they are and really understands what they're going through. So if they hit a bump, they got that support that they need. So that's where I am at this point. I'm sort of at that level of outpatient provider, where I'm seeing people once a week or biweekly, and working on usually very specific goals around trauma and healing from trauma, and helping kids with anxiety. I do a lot of work with teens and anxiety, how to manage it and how to kick it in the butt and how to figure it all out. So yeah, so you will find art therapists at all kinds of different levels and with different specialties.
Wow.
And I think that's the hard thing when you're navigating, is like, what therapist do I want? What do I want to look for and what do I need? And hopefully you choose a therapist that you can sense that they're going to be a good match for you.
Well, um, what should one look for in a good art therapist? Like, art therapy already seems like something that people might like. Therapy in itself, counseling in itself, is something that a lot of people tiptoe towards. Like you were saying, there is stigma. There's like certain stigmas around mental health services, which shouldn't be the case.
Right.
But when you talk about approaching art therapy as, all right, so I'm actually going to go the art therapy route. I'm going to try the art therapy route and see how that works out for me. So what should then that person be looking for in a qualified art therapist?
Yeah. So any art therapist has to be a master's level trained therapist. So that means that they have um, gone through a master's program, and typically that master's program, you'd be hard pressed to find any that aren't dually licensed, and that has a lot to do with our ability to be able to be reimbursed by insurance and all the like legal and ethical blah 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 stuff that is just
That makes sense.
necessary in our field.
Okay.
But you will find that, so there's a couple initials that you'll look for. So ATR-P is an art and registered art therapist, but their license is provisional. And that just means that they've graduated from their program, they've gone through all the paces that are required for them to do so, and they're now accruing supervision hours. And so what that means is after we graduate, we have to continue to connect on a weekly basis with someone who's been in the field way longer than we have, right? So as we begin to work with people and in whatever environment, if it's hospital, if it's outpatient programs, if it's elder care or whatever, wherever we are, we seek out supervisors who have that same specialty and who have that same skill set, so that we can refer to them when we aren't sure what to do, when we need a little bit of advice, when we need to bounce an idea or a treatment plan off of somebody. And so we're required to do that for, as an art therapist, for 1,000 hours. I think that's the 1,000 hours of our work hours. So that is basically for every 10 hours, you are supposed to spend 1 hour in supervision.
Mm-hmm.
So we're reviewing cases, we're making sure we're doing things properly, we're being, advised. And that's just to help us build our skills, but it's also meant to protect the public. It's like a new doctor. You don't want somebody just graduating and cutting you open. You want someone who has been watched and, trained and supervised. And so we have those things built into our field as well. And an art therapist is put through their paces and trained up and supervised. Then when you're completed with that, you submit your hours to our certifying board, which is the ATCB, is our certifying board. Everything is reviewed, and they make sure that you have your supervisor's signatures, and yes, she was there that many hours, and yes, these are the hours that we did supervision. And then you can apply to take the board certification test, which is something you sit for and is super formalized process. And then once you pass that test, you are considered board certified. So that usually takes people between 2 to 3 years to do after they graduate. So by then, you are independent art therapist. I don't have to be supervised anymore. I can practice independently, and I can usually do pretty much all the things that I've been trained to do on my own. I can always consult with colleagues if I need to, but I don't have to. So that's what that credential means. So the ATRBC means they've completed all their hours, they've submitted them, and they have taken the board certification test for their ability to work independently. So it's similar for licensed professional counselors. And when we graduate, we have completed whatever master's program hours we need to. We then take a test and we get something called the LPC. There's only one C. Then we have to accrue 3,000 hours.
Okay.
Under supervision. And we do so under a licensed professional clinical counselor who has an S designation. So that means they're a supervisor.
Okay.
You typically pick for art therapists, we will typically pick duly licensed supervisors so that I'm accruing hours at the same time
That's
until
very
I get,
smart.
yeah. And so then I submit to the Board of Ohio, the Counseling, Social Work, Marriage, Family Therapist Board. When I am done with my hours, I submit those hours and they check everything. They make sure it's all verified, all that. Then I get to sit for my independent licensure test. So when I take that test, it's all about diagnosis. So it's about cases, conceptualization of cases, diagnosing, treating. It's a really hard test. It's a really, really hard test. And once you pass that, you get your extra C. And that means you're independent. So then that means I can practice as a independent licensed professional clinical counselor. So those two together, what I have means I did a lot of stuff to
Yeah,
get
that's what it
to
sounds
that place.
like.
And that I've been put through my paces,
Mm-hmm.
which is what you want. You want to know that the person you're working with has the support that they need, that they have the training that they need. And then you can, as a counselor or art therapist, you can get additional specialties. And that's kind of what people do in the, like, after they get their first 2 to 3 years of experience, then they start to go, oh, this is where I'm going to really zero in on. And for me, that's trauma. So that's why I have extra credentialing and training in EMDR therapy.
Okay.
So as far as selecting somebody, I think just kind of knowing what stage of their profession they're in and what area of specialty they are interested in and getting their experience in. So if you have problems with addiction, you want to you want someone who really is passionate about treating addiction and who knows their stuff and who also more than likely should understand trauma because there's such an overlap with like addiction and trauma. Um, and if they happen to also be an art therapist, it's like bonus to me, in my opinion. It's like, woohoo, and we're going to make some of this fun, believe it or not. Or
Uh-huh.
we're going to make some of this about connecting to your creative energy and understanding how that can help you heal and how that can help you caretake yourself.
Okay.
Sometimes we teach people how to cope with life through their creativity by using it. Talk about creative flow. Like, I know as an artist, you know what that means, right?
Oh yes. Oh yes.
It's like you could not eat for 5 hours or go to the bathroom and you're just like,
Oh my
what?
God. I try to tell people like I forget to eat. I forget.
Totally.
It's real.
Right. And so, but that's like a life-giving energy that we all have access to. And I think that if we have blocked that in our lives and we have um, disconnected from that, um, there's a real opportunity to find a new source of energy and um, I don't know. I've seen people who didn't think they were creative or artists discover that they were really good at something, or that it just gave them pleasure and they didn't need to be good at it. They just really enjoyed it. And so I think, that's what our therapists bring to some of these tougher diagnoses or things that people go through is in addition to having those qualifications of really working on very specific treatment goals, you get the added bonus of someone who's understanding of how to bring the creative part of you into the whole, treatment program. So
Oh,
that's why I didn't want to be just a therapist. I wanted to be both. So
that's very attractive to me about therapy, about art therapy. Hearing that, it makes me, it makes me kind of want to look into art therapy. Like, okay,
do
I
it.
might even become a better artist out of this. But
Yeah.
but to just a follow-up question on that. When looking for a therapist, because I go to counseling myself,
Mm-hmm.
and I actually had to go through a few therapists before I landed on the one that was right for me.
Yeah.
And so, I guess, how do you feel like when you find the right art therapist? I guess, are you looking for the therapist first, the counselor first, and then whatever comes out of it creatively, or what?
Yeah, I think it's probably like whatever process you went through, it's a process. Um it's like any other relationship. You know, obviously a therapeutic relationship's not the same as like our more personal relationships. But to me, what makes any therapeutic relationship work is the connection that you have with that person and the ability to have that person um, meet you where you are, but also push you a little, you know, like nudge you, like be
Yeah.
able to be like, okay, have you considered maybe, you know, looking at it this way, or how about, you know, and so you want to have someone that you feel a sense of trust. And you know, I think there's also some things that are just, it's almost like intuitive. It's like on a gut level, you just feel drawn to that particular therapist. And I'm the same way as you. I've had different therapists for different reasons. I may have gone to somebody who specialized in grief when I had gone through a really profound loss.
Hmm.
Um, and that was their specialty. You know, that was what they were known for. And I had heard great things. So you know, and it was a good match. And I've had other ones where I was like, after the first session, I'm like, nope, nope, not my person, not my person, you
Hmm.
know. And I think it's okay, that's okay. And
Hmm.
that's the one thing I always tell people when I interview them first on the phone to like see if we're a good match is, I don't care if it's me, I care that you get the support you need. So if I interview someone and I know my skill sets really aren't a match for them, I'm pretty connected at this point. I can usually refer them to somebody who I kind of know, like, this is probably more your person, you know?
Okay.
And so one thing to know too is most therapists are pretty clear about their skill sets and what they're capable of. So just by default, like if you come to me and you say, I have anorexia, or I have um, um, I'm not a specialist in autism, for example. I know for sure I'm just not the right person. We don't even need to talk. Like, but I do know people who are in that part of my field and who would be excellent at helping you and helping your loved one. And so part of it is just being really honest about what you're looking for. And then there's also, you know, sometimes it's a financial and insurance type of decision. And oftentimes we get a list of people, you know, that are on our insurance or, you know, whatever. And if you can do out of pocket, sometimes that frees up your choice a little more because you can pick someone based on just that kind of true connection, and the
Yeah.
insurance piece isn't part of your decision.
Right.
So sometimes that factors in. Um, so yeah, I think it's kind of like giving yourself permission to interview people and really understand, um, you know, what is it I'm looking for, and hopefully that therapist can really be a part of that too. Um, you know, and I always tell people sometimes it takes a couple sessions to really know,
Hmm.
you know, and you know, if at any point along the way you're like, Jody, you're not my cup of tea. You know, I thought we'd be good together, but it's just not quite. This is more what I'm looking for.
Right.
Then sometimes it's just a matter of refining what you need and want, and that therapist can then refer you to somebody who's a better match. Um, but yeah, I think it's fine to be picky.
Yeah. Yeah.
It's just, this is a big deal. You know, you're going to share things that maybe you don't share with other people, and you want to be able to feel like that person has not only the skills and the ability to move you forward or help you heal, but that, yeah, that you want to show up to therapy, you
Yeah. Yeah.
know?
Speaking of that, I have speaking of wanting to show up to therapy, I have had friends and you know, coworkers or people that I've known, and I know that you work a lot with children, but I've known people who have had kids who they wanted to put into therapy, and it was just regular, you know, talk therapy or counseling, but their children would be uncooperative or never wanted to go, or when they did go, they never wanted to talk, or things like that, where the parent was hitting these roadblocks because, you know, the child might not have felt like there's nothing wrong with me. Like, why do I need to talk to you? Like the
Yeah.
idea of them being a problem child didn't cross their
Yeah.
mind, or they weren't a problem child. They just had things that maybe they needed to work out, maybe a divorce, maybe a loss, maybe just, behavioral things that the parent had no idea where this was coming from.
Right. Yeah.
So like, I'm bringing this to you in the context of working with children, but I'm sure you might have experienced this or seen it at least across the spectrum of patients or clients that you might have come in contact with. And I'm just wondering if you've hit that roadblock and what you do about that sort of thing.
Yeah. Yeah. Um, I think it's complex because there's a whole lot of reasons why people may feel resistant to getting support or, being asked to go see a therapist. Sometimes it's the stigma of like, I don't have a problem, I'm fine, I don't need your help, that kind of thing. Sometimes it's, um, you know, families are complicated, and sometimes a child can't feel like they're the ones being asked to do all the changing or and it's actually a whole family systems thing going on. And so, sometimes you need to have um, the whole family being part of, you know, um, change and growth, and that it isn't just one person doing all of the heavy lifting for the entire family. Because believe it or not, some of the kids that do, struggle and act out, they're really almost like the messenger of the family. They're kind of showing the family what isn't working, what isn't, what isn't functioning correctly, or to the best of their ability. So, if I have someone who's like just really resistant, like, I will see if we can just start by creating together, like no pressure. And I will say, you know what, this is for you, it's your space. If after a couple sessions, this is just not something you want, or you don't, want to come and talk or create together or whatever it is, then that's cool. I'm not here to force you into anything. And so sometimes that can open up a bit of like the pressure's off. I don't have to come in here and talk about my feelings and tell you all the personal things. That it's more about like, and I've had people where it took months of just creating, showing up, getting to trust me, making sure I wasn't really like the other adults maybe in their life, or that I wasn't aligned with their parents in a way that made them feel like I was in cahoots. There's a lot of that happens, especially in teens, is just needing to know that like this is actually my space and for me.
Right.
I don't work with anyone who just is really, really adamant about not doing it, because it just doesn't work. It's like you can't force somebody to open or like investigate themselves or think about things or be reflective if they just really don't want to. And that's hard. I think that's particularly hard for parents. And sometimes, it has to get to a place where we're talking about those higher level of care, where we're getting really into some, some stuff where they really have to get a different level of care going on for their whole family. Like maybe the whole family is really in crisis and they need, more than what I can give. But for the most part, I think that's one of the, I think that's one of the calls I get the most, is my kid just didn't like talk therapy. They just didn't have anything to talk about. But I know they're grieving. I know they lost their best friend to suicide. I know they're not okay, or I know that they're self-harming and they're not talking about it. And, sometimes being with someone who, as an art therapist, I think maybe one of my superpowers is that I can be quiet.
Yeah.
We can have a session that we don't talk, and there's no pressure to talk. We can just let you be in a space that's solely for you, and we'll see what surfaces, what needs our love and attention. And sometimes that process takes quite a while, but it's a building up of trust that happens. And with adults, I think, I mean, most people, at least in my kind of part of the world of therapy, most people come to me actively and they really are like, they're like, I'm done with these patterns. I'm sick of how trauma shows up in my life. It's wrecking everything. And I'm just ready. I don't care what I have to do. I'm doing it. Sign me up. And so I
Right.
get mostly, adults who are super invested and really want to, like, they've tried other things and they're just ready for something different. But we all will bump up against our resistance to change. I don't think any of us, including myself, see some of these darker, shadowy parts of ourselves and be like, yeah, let's dig into this. Oh, great, we're going back around circle on this family stuff. Yes, I'm so glad. I'm almost 50 and I have to think about my mom issues again. Great. So like sometimes we'll use that in session of like, why did you skip last week? Like, why didn't you show up for yourself? What's going on? What part of you is feeling like, I want to, like, hightail it out of here? And we often can use that resistance to kind of explore and understand maybe another part of ourselves. And creative process can show us that too. I know we all get stuck as artists, or we're like, oh my God, I'm spitting out the same thing over and over again here. I need something different. And we come up against our own blocks too as artists.
Mm-hmm.
And, sometimes if we use those blocks, something really cool happens,
Mm-hmm.
we push through it. So I'd say, to answer your question, it's a little tougher with kids, because some of it's just like, what is this thing you're asking me to do? And they're just not familiar with what therapy could look like. And so with that, I use a lot of play, a lot of the creativity, games, connecting through their world, coming down to their world and not projecting my adultness onto everything, you know, trying not to, at least.
Right,
Um,
right.
and with adults, I just try to use it in session. Be like, well, let's look at, what part of you isn't wanting to show up right now?
Mm-hmm.
What part of you is sick of this? What part
Okay.
of you is pissed off that you have this trauma that happened to you and it feels unfair, or, like you're sick of it. So that's how I work with resistance and, doubt and lack of desire and motivation to maybe get the support you need.
What about the other part of resistance? Like, there's the therapeutic resistance that we just talked about, but you also mentioned artist blocks. And one of the biggest artist blocks, I think, is the first one that people usually encounter, is the I'm not good at this block. I'm not an artist. I really can't paint. I can't draw. I can only do stick figures. Blah,
Oh,
blah, blah.
you got it. You're nailing it.
How do you deal with that? Like that self-doubt,
Yeah.
self-consciousness, insecurities? Like how do you work through that with people who are sometimes creating art for the first times in their lives, or for the first time in literal decades?
Yeah. Yeah. Absolutely. I think, and I'm not the person who coined this, but I can't remember who it was, but someone called it the artist wound. It's like, where in our lives were we told that we weren't creative? Like, when did that happen? And like, so many people can name it. Like, I was 7 years old and my art teacher told me that's not a snowman, or what, they have these horrific stories where they were shamed
Mm-hmm.
around their creativity somehow, or that music teacher who said, you're tone deaf, you can't sing,
Right.
or that, very critical parent that maybe, you know said something. And we're, creativity, that part of us is so vulnerable sometimes. It's like, it's vulnerable to create and then show it to someone,
Right.
or to somehow put it out there in the world. It's almost like, having a child. You take this creative idea, you let it kind of marinate inside, and and then you like try to bring it out to the world, and then it's there, and it's like, oh, You know,
Yeah,
who's
you're
going
trying to
to
protect it
say
now.
this is awful and who's going to judge this? And so I think oftentimes my clients will find that they really um, come to their creativity at the age in which they started to identify with these limiting beliefs. And if we can kind of see them for what they are, which is self-limiting beliefs, it's not true. You aren't. You are creative. Every single human being has a birthright to be creative.
Hmm.
We are creative. We are. It's just, it's what we are. It's what we do. Look at everything that, has been made. That's an act of creation. And so we receive a lot of really negative messages around creativity and what the purpose of it is, and why, what an artist is, what a musician is, what a writer is. And I think if we can broaden the definition of creativity, that it's simply an act of you connecting to something within yourself and allowing it to move through you, um, as unimpeded as possible. That it could just be a source of nutrition, like food or water or anything else. It can just be for you. No one has to look at your piece of art. No one has, it doesn't have to be in a gallery.
That's true.
It doesn't have to it doesn't, no, it doesn't have to make sense to anybody.
Hmm.
It can be literally just for you. And I think that's the part that a lot of people have disconnected from, is that their creativity isn't for them. It's a product, it's a grade, it's going to be judged somehow, or deemed worthy by some external source. And if we can kind of bring that back in and work with it, oftentimes it's connected to all kinds of other stuff, like the inner critic. We have that horrible critical voice that just shuts us down all the time in all kinds of ways. Like, how do we develop a kinder voice within ourselves when we're taking risks, when we're being creative? How can I tell my inner critic to shut the, what, up and just let me paint?
Yes. Yeah.
you know
Just let me paint. Jeez.
Leave me alone. Or to do bad art. I used to do this in my group sometimes on the different units that I used to work on. Is like, today we're going to make really ugly art. And like, they're like, what? Yeah, we're going to make it as ugly as possible. And it's so fun to watch people go, that's a thing, like you can do it. Just, yes, you can. Like, so you get people making the ugliest pukey booger green paint that they could make. You get the people stomping on it and making footprints all over the paper and tearing it and spilling their coffee on it. And
Hmm.
you just get people like going into it, and then they're like, an hour just passed. Yeah, because you just circumvented all your limiting beliefs, yourself, your inner critic, and you just let yourself play. You let yourself be a kid again for a minute, you know and I think that is what we're craving, and we forget that we can do that and be an adult and do all of the regular version of ourselves, sort of the part of us that shows up and does life. That there's this other part that's super dry and crispy and worn out from it, and if we can like connect back to it and bring some creative energy and fuel back to our lives, I think it floods out to other things, our relationships, our careers, or whatever else, we're doing. So I think creative blocks are a huge opportunity. I love them. When someone
Wow.
says they can't draw, I'm like, yes, you're my favorite person. I love working with people like you. Just wait, just wait to see what you can do. And as an art therapist, I can help them stay with the discomfort of not knowing. Okay. And so isn't that what we need to do in life when we're anxious, when we're really scared about the future, or we don't know what's going to happen, or something really hard happens to us? So we're really thrown into that discomfort and that uncertainty. And so if we can give ourselves permission to do it on a really small scale with this little piece of paper and these materials, and you can be in the discomfort here where it doesn't really matter, because
Hmm.
what are you doing? It's just paint and paper. It's okay. There's nothing really, you could throw it out if you want to.
Right.
How could we then do it in harder areas of life? how can we take the experience of being uncomfortable making art or being creative and translate that to something like a career move or getting out of a bad relationship or confronting someone who harmed you or hurt you. You know what I mean? Like, how can we then, take this little risk, this creative risk, and blow it up into something bigger for you? So yeah, creative blocks are, you can tell I get excited about them.
Yeah, yeah, I can. Like, wow, wow, absolutely. That's incredible. I can tell you that definitely listening to you as an artist, listening to you speak this past hour or so, I don't know. It's definitely left me inspired as an artist, but also as an individual to start to try and connect with that. And I think it's great helping people who don't consider themselves creative find that flow, find parts of their creativity that can translate to their everyday life. And
Yeah.
it's also great to see that it's, as a field, art therapy is taken so seriously. And I think, like, coming into this, like I said, my question was, is art therapy legit? And you have answered it in its entirety. And
Yay.
you you definitely might be getting a phone call from me, but uh,
Cool.
go ahead and tell everybody what they can do in order to get in contact with you if they're looking for your services or some references.
Sure. I have a website at www.trulyconnectedcounseling.com. That's my private practice. I'm also working on some things that will have a broader reach, so people will be able to connect in ways like some coursework, I'm writing a book. It's very early on, so I'm not even talking about it yet, but it has a lot to do with these like things we were kind of touching on today of like, how do we break through self-limiting beliefs and, intergenerational narratives that don't serve us anymore, and like just all of these ways that we're really needing to break out and take some risks in our lives. So that's forthcoming, but I'll also be announcing that. But I have a separate website called trulyconnectedinstitute.com, and that's going to be some of where I'll announce some of these things as they kind of get birthed into the world. So if anyone wants to find an art therapist and know that they're credentialed, people can go to ADA, which is the American Art Therapy Association. They often have directories and listings of people. Ursuline keeps a really nice list of art therapists that are out in the community. So if you want to find people who maybe have a specialty that you need, that's a really great way. Most of us, at least in this area, we know each other pretty well, and we kind of understand where we all live and work, and we can do some nice referrals and stuff. So yeah, that's where you can reach me.
Awesome.
I have a Facebook page. I kind of try to put a lot of stuff through that as well. Sometimes I'll do lives about things like this, or I'll do articles and research and things that people can check out on their own. So
Well, I'll definitely be giving you some shout outs too when all those things release. And I'll be following you too on Facebook and on that Truly Connected Institute. Thanks so much for taking some time out of your day in order to speak to me and my audience about art therapy, because I actually think that this was a very important conversation for me personally, and probably for a lot of other people who are out there just trying to find a way into therapy that might be a little bit underthought of, So
yeah,
thanks a lot.
absolutely. It's my pleasure. I'm always excited to share.
Exactly. The more people, we need to normalize therapy and art therapy.
Absolutely. And by the way, I'm in therapy all the time. So that's a good question to ask your therapist. Are you in therapy?
That is a good question. I never
Yeah.
thought to ask my
Yeah.
therapist that.
Because we need support, and we're humans and we're going through stuff too. And so that helps us stay healthy and to keep our stuff out of our therapy spaces. So yeah, it's an important thing.
Great. Everybody, check out Jody Pittner. Also, check out this interview on theindigokid.com or the Indigo Kid YouTube channel. I'll see you guys there.